Hey everyone, to see a doctor. So let's get started. Stick around because this information could make a big difference in your life. Let's start with a common issue that can sometimes be the root of pelvic pain: constipation. It's more common than you might think and can be quite uncomfortable. When waste builds up in your lower colon, it can put pressure on your pelvic area, leading to discomfort and pain. This pressure can cause a variety of symptoms that are often mistaken for other conditions. This type of pain is often described as a dull ache or cramping sensation. It can be persistent and sometimes even debilitating, affecting your daily activities. The good news? It usually subsides once you're able to have a bowel movement. Relief can be almost immediate, making it easier to get back to your routine. Simple lifestyle changes like increasing fiber and fluid intake, regular exercise, and stress management can make a world of difference. These habits not only help with constipation, but also improve overall health and well-being. Constipation isn't the only digestive culprit behind pelvic pain. Conditions like irritable bowel syndrome, IBS, and ulcerative colitis can cause cramping, bloating, and pain in your lower abdomen and pelvic region. Diverticulitis, where small pouches in your digestive tract become inflamed, can also lead to pelvic pain. If you suspect any of these issues, it's crucial to see a doctor for proper diagnosis and treatment. Let's talk about endometriosis, a condition affecting millions of women worldwide. This is where tissue similar to the lining of your uterus grows outside of it, causing inflammation, pain, and scar tissue. Endometriosis pain can range from mild to severe, often described as a deep, aching pain that worsens during your period. If you suspect endometriosis, consult your doctor for diagnosis and treatment options. Fibroids are another common cause of pelvic pain in women. These non-cancerous growths develop in the wall of the uterus and can cause significant discomfort. Imagine a cramping or heavy feeling in your pelvis, pain during sex, or pressure on your bladder or rectum. The size and location of fibroids play a big role in whether they cause symptoms. If you suspect fibroids, your doctor can help determine the best course of action. Pelvic inflammatory disease, PID, is an infection that affects the female reproductive organs, often caused by STIs like chlamydia and gonorrhea. PID can lead to chronic pelvic pain, infertility, and ectopic pregnancy. The pain from PID is typically a constant dull ache that can worsen during sex or after your period. Other symptoms include fever, unusual vaginal discharge, and pain during urination. If you experience any of these symptoms, seek medical attention immediately. Ever experience a sharp, sudden pain in your lower abdomen around the middle of your menstrual cycle? That could be ovulation pain, also known as Mittelschmerz. It happens when the follicle in your ovary ruptures to release an egg. While it's usually nothing to worry about, it can be uncomfortable. Over-the-counter pain relievers and a heating pad can help. Sometimes pelvic pain can result from scar tissue or adhesions that form after surgery, infection, or endometriosis. These bands of scar tissue can bind your organs together, causing pain. Treatment options vary, but can include physical therapy, medication, or surgery. Adenomyosis is a condition where endometrial tissue grows into the muscle wall of the uterus. This can cause heavy, painful periods, pelvic pain, and an enlarged uterus. While the exact cause is unknown, it's thought to be related to hormonal changes and previous uterine surgery. Treatment options range from pain relievers and hormonal therapy to surgery in severe cases. Some STIs can cause pelvic pain even without progressing to PID. Chlamydia and gonorrhea, for example, can cause pelvic pain or cramping on their own. The key takeaway is that if you're sexually active, practice safe sex and get tested regularly for STIs. Early detection and treatment are essential to prevent complications like PID and chronic pelvic pain. Menstrual cramps are a fact of life for many women, but severe pain that disrupts your daily activities is not. Conditions like endometriosis and adenomyosis can cause severe menstrual cramps. Your doctor can help determine if an underlying condition is contributing to your pain. Appropriate treatment options can help manage the pain. Ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. Pelvic pain is a common symptom, often described as a sharp, stabbing pain. Other symptoms include vaginal bleeding, dizziness, and shoulder pain. If you suspect an ectopic pregnancy, seek immediate medical attention. Miscarriage or pregnancy loss can cause physical pain, including cramping and pelvic pain. The pain can range from mild to severe and may be accompanied by bleeding. It's important to remember that miscarriage is common and not your fault. If you experience cramping or bleeding during pregnancy, contact your doctor immediately. Appendicitis, or inflammation of the appendix, requires immediate medical attention. The pain typically starts as a dull ache near the belly button and then shifts to the lower right abdomen, becoming sharp and intense. Other symptoms include nausea, vomiting, loss of appetite, and fever. If you suspect appendicitis, don't delay seeking medical care. A hernia occurs when an organ or tissue pushes through a weak spot in the muscle or tissue that holds it in place. In the lower pelvis, you might experience pelvic pain and notice a bulge in the groin or lower abdomen. Hernias require medical attention, and treatment often involves surgery. The muscles in your pelvic floor can spasm, leading to pain and discomfort. The pain can be sharp or dull and might worsen with certain activities like sitting for long periods or having sex. Treatment often involves physical therapy to relax and strengthen the pelvic floor muscles. Prostatitis, or inflammation of the prostate, can cause pain in the pelvic area, groin, lower back, and during ejaculation. Other symptoms include pain or burning during urination and frequent urination. Prostatitis can be caused by a bacterial infection, and treatment typically involves antibiotics. If you're experiencing pelvic pain or other urinary symptoms, see your doctor. UTIs can cause pain or burning during urination and frequent urination, but some people also experience pelvic pain or cramping. This is more common with kidney infections, which occur when a UTI spreads to the kidneys. If you suspect a UTI, see your doctor for a proper diagnosis and treatment. Untreated UTIs can lead to serious complications. Interstitial cystitis, also known as painful bladder syndrome, causes pain and pressure in the bladder and pelvic region. Symptoms vary but often include pelvic pain that worsens with a full bladder, frequent urination, and an urgent need to urinate. There's no cure, but treatments focus on managing symptoms and improving quality of life. Kidney stones are hard deposits that form in the kidneys and can cause excruciating pain as they pass through the urinary tract. The pain is often described as a sharp, cramping pain that comes in waves and radiates from the lower back to the groin and pelvis. Treatment varies depending on the size and location of the stone, but may include pain relievers, medication, or surgery. Ovarian masses are growths that develop on the ovaries. While most are benign, some can be cancerous. Pelvic pain is a common symptom, especially if they grow large enough to press on nearby organs or nerves. If you experience unusual pelvic pain, see your doctor to rule out any serious conditions. Stay informed and take care of your health.